Welcome to Inside Healthcare. In this program, we're bringing you awareness and hope about diabetes and breast cancer, both devastating diseases that affect many of you and your families, including my own. Plus, we're talking about hope for the holidays during these tough economic times and how you can help local families. We begin with diabetes, since November is National Diabetes Awareness Month and November 14th is World Diabetes Day. The World Health Organization and Lions Clubs want to bring awareness to educate everyone about this disease and why it's important to manage it. And we are very pleased to have with us Adou, and here with one of the local Lions Clubs. So thank you for being with us.
Thank you very much, Judy, for having me.
You know, before we get into about Lions being involved, you know, I've read that there's been an increased number of cases of diabetes, a lot, since COVID because of that. What is the current situation of diabetes here in Minnesota?
Well, in Minnesota, we have 24,000 cases every year. New cases every year in the state of Minnesota. I mean, that's a big number. And the unfortunate part is a lot of people have diabetes and they don't know they have it. For example, if you look at the United States as a whole, 96 million people have prediabetes. And then 38 million have diabetes. About 28 million know they have it, they've been diagnosed. And about 8.5 million, they don't know they have diabetes. So these are big numbers. And the sooner we can, diagnose someone with diabetes, type 2 especially, we can hopefully reverse the impact on their health and help them, get better and fight that disease. So.
As I mentioned too, with COVID, it just seems like in those patients that came down with COVID had complications, ended up in the hospital because of the diabetes as well.
Yeah, and of course, I mean, staying at home, because a lot of us stayed at home or worked from home, and of course, some of us were not very careful in our diet, and we did not do as much exercise. So of course, that will add to to the causing more diabetes cases. So hopefully, now we're out of COVID, hopefully, and we are doing more physical activity outside the home, and hopefully we can be a little more careful about what we eat. And I think that should definitely help us.
With so many people possibly pre-diabetes or diabetic, how do they know? I mean, what are symptoms?
Yeah, well, really, you don't really have symptoms. You don't really even know you have it. So the best thing to do is just get tested. Your doctor, when you have your annual exam, just a simple blood test would really give you an idea if you have it or not. A1C is a very simple test. Basically, A1C does give you an idea how's the blood sugar in your blood for the last 2 to 3 months.
Oh.
Normally, if you are 5.7% or less, you don't have any diabetes or prediabetes, but between 5.7 and 6.4, you are pre-diabetic. If you have 6.4 or above percent, you are diabetic. So these numbers are really, and the test we were going to do on November 14 at the Y, when we do the free diabetes screening, we can test and we can see what range your blood sugar is, and we can tell you hopefully that you don't have diabetes or prediabetes, but at least you get an idea what's going on in your blood. So
and if you are diagnosed, there's treatments available. There's
yes,
type you 2 can manage it.
Definitely type 2. I mean, I can tell you. Excuse me, I have diabetes now for 30 years, and I don't take any medication. Basically, I control it by diet and exercise. So it can be done. And people normally with some little minor life changes, like, you can, if you do maybe exercise 20 minutes every other day, walking, going on a bike.
That is all.
That's all. And then have a healthy diet of vegetables, fruit, low carbohydrate. So really, it's very easily managed, Because if you don't manage it well, then you're going to be on medication. Then eventually, if you don't really get it under control, you need to take insulin. So the sooner you catch it and you deal with it, the better the chances.
And it's so important to manage it because it can damage eyes, your heart, your kidneys, your circular system.
True. It's the number 7 cause of death, diabetes. It could be because you have, some people have kidney failure. You can result in some amputations of the lower extremities, or you could have blindness. So the consequences are really severe. So the sooner you get health advice on that and the treatment, I think it looks really good if you follow your doctor's instructions. Again, it doesn't really take too much. When I was diagnosed, I did not really have to change much because I was always eating healthy, and then but every time I eat, I figure in my own head how many carbs I'm eating.
Wow.
Try to measure it. I don't deprive myself, but at least I know when to stop and what kind of food I need to eat.
Yeah, I sadly lost my older sister a year ago from complications from diabetes. It had damaged her kidneys and her heart. She never had heart problems previously, so
yeah,
I know all too well.
It can, in fact, impact so many things in our body, and and again, I get like once a year I get annual checkup. I have eye exam. These are all, and every 4 months I get my A1C tested
Oh, okay.
to make sure I'm still within the range of acceptable range, so I don't fall behind. And I don't like to take medication, but if I have to, I have to. But so far, so good.
And are people surprised that the Lions Clubs are supportive or have initiatives addressing diabetes?
Well, I don't think many people know we do have the diabetes as one of our pillars. We have 5 pillars, the Woodbury Lions. We have sight, we have childhood cancer, diabetes, hunger, and the environment. These are really 5 focus areas. And diabetes and childhood cancer, we introduced that about 2 years ago. And because we felt this is really important that we raise awareness about these 2 diseases in our community. And we've been really working very hard with some partners. Like, for example, the diabetes screening is in partnership with Walmart Pharmacy here in Woodbury. We also partnered with the Y. We're gonna have the diabetes screening at the Y on Monday, November 14th.
Yeah, I was going to ask you about this health screening that you have coming up on World Diabetes Day.
Yeah, it's this is our 2nd year, and then again we approached the Y, and they agreed to let us use one of their rooms because we feel it's in the middle of Woodbury, and hopefully we have more traffic. And I'm going to be putting a big sign inside the Y, and some brochures, so people going to the Y, they can at least see what date, and they can pick up a card that has some information about type 1 and type 2 diabetes, and then again we wanted as many people to come as possible because we live in this community and we want to have healthy community.
You can save lives.
Definitely,
yeah.
Definitely.
So is there any limit on the age of people? Do you have to register to be part of it?
No. You can. They can just show up. They can show up, and then basically they will have a form that the pharmacy required them to fill in, a simple form, and then just the test takes about 10 minutes, and they will know the results
and it's
immediately.
Just a
poke in the finger, and then they get the result immediately. And also, the Walmart Pharmacy will be also offering flu shots if anybody is interested in getting a flu shot.
That's another thing. Yeah, we're hearing that we're expected to have a real outbreak, and it's already starting to see in parts of the country right now.
Last year, actually, they also gave COVID shots too, plus the flu shot and then the diabetes test. So it's just like I said, I encourage anybody who's watching this to really come and see us at the Y. And it's between 10 o'clock and 2 p.m., 4 hours. So we will have we'll have plenty of hopefully we'll have plenty of community members.
Why is this a passion of yours? Why are you so interested?
Well, I have diabetes, type 2 diabetes, and I know it can get out of hand, and I would like to see people find out if they have it so they can at least do something about it before it's too late. We want to have a healthy community, and then I just care about our community, and we'd like to have people in the community healthy, have healthy families, and then that's definitely something that you're right, passionate about.
Well, you're a living example of what we should all be doing too, watching our diet and exercising and staying healthy and getting our regular checkups. Yeah.
Well, thank you. Yeah, it doesn't really take much. You just have to really do it. You just schedule those appointments with your doctor and with your eye doctor, and then hopefully you'll be fine.
Final message for our viewers about diabetes.
Again, eat healthy food, plenty of vegetables, fruits, low carb diet, and also exercising. Exercising is extremely important. When I retired a year ago, I was so worried about, I'm going to stay home, especially during the winter. So I got myself an exercise bike. I have it at home. So in case I'm not doing something in the yard or outside the house, so I can always get on the bike for 20 minutes, and that will do the job.
Yeah, I did walk yesterday, and I was glad. I feel good the rest of the day. And
yeah,
stuff.
it makes you feel good,
yeah.
and then I think it makes you feel energized, and at the same time, you're burning calories and helping your heart, and exercise is really good for all of us.
Well, what a pleasure, Dom, to have you on Inside Healthcare. We really appreciate it.
Well, thank you so much, Jody, for having me. I really appreciate it. Thank you.
Thank you so much. Up next, a local doctor offers some new hope in the fight against breast cancer. Stay with us.
Vision loss is not something that you feel until it happens.
Most people lose their vision from diseases like macular degeneration and glaucoma, not at birth.
3 million Americans have glaucoma, and half don't even know it.
11 million people in the United States have macular degeneration.
So many eye disorders can be treated if caught early.
Make a plan today to get your eyes checked.
Visit brightfocus.org to learn more.
Breast cancer is one of the most common cancers for women. Sadly, I lost my sister Chris to breast cancer. Breast cancer survivors and the Breast Cancer Gaps Project are helping to educate women to beat breast cancer. A local radiologist from Regents Hospital, Dr. Soma, who specializes in diagnosing and treating breast cancer patients, talks about the new Gaps Project and what it means in particular for Black women.
The Gaps Project is really kind of a community co-design project, and the whole idea of it is to try to close the gap in screening and outcome disparities for Black women. Even though Black women are less likely to develop breast cancer, they're over 40% more likely to die of breast cancer. And this project really aimed to figure out and to implement some plan that can help us to close that gap in our communities here.
And do we know why there's this disparity between the number of mortality among Black women?
Yeah, so part of the project was trying to answer that very question. We believe it's multifactorial. Some of it is access. Some of it is information confusion. Some of it is fear and distrust. And we hope to help address all of those issues with the projects that we're wanting to implement in the community to bring in more Black women for screening.
And what do you think some of those misconceptions or that women have?
Yeah, so for some people, it's just the fear of the mammogram itself, that your breast is in compression for several minutes, that it really hurts, that if you have breast cancer, that mashing it or biopsying it may make it spread. Some of it is just a distrust of institutions in general, and whether they have the well-being of minority people at heart. So we really hope to help women see the health systems as a partner for their health. And part of that is putting a face out there with people that kind of look like them so they can develop the trust and not suffer the ill health effects of not coming in and getting a study that could potentially save their lives.
And as a radiologist, what are you seeing from the personal standpoint?
Yeah, so, every day we see lots of women in here. For most of them, the outcome is good when they come here. Most people do not have breast cancer, even though there's a scary statistic that 1 in 8 women will develop breast cancer. That means 7 out of 8 don't. And so for most people, we're able to give them good news, but it doesn't matter. Once a woman walks through the door, almost all of them are convinced that there's something terribly wrong. And it's very anxiety provoking, from getting a screening mammogram to being called back for more imaging, or possibly needing a biopsy. So a lot of what we do here is try to answer questions and to also help people to get past the anxiety to be able to get the studies that they need. But I often joke that we work in the department of worry, because so many people are absolutely terrified to be here.
And why are you involved with this? Why are you speaking out?
Yeah, so really twofold. One, as a radiologist that specializes in breast imaging, every day of my career is dedicated to the detection of breast cancer, hopefully at an early stage. And so just at baseline, that's my passion, to get as many women in here as possible. And then obviously as a Black woman coming from a family of lots of Black women and a lot of breast cancer in my family, it's personally, something I'm very invested in. And we want more survivor stories in the Black community, not immemorial stories. And so I'm really passionate, and this project has been fantastic.
Final comments that you would give to women that are watching your interview. What would you say to them?
Well, the first thing is, we know you're scared, but most people aren't, and we want you to come in anyway. If you can get a friend, a sister, your mom to come with you, not only does that decrease the anxiety, but it also may save their lives too. We want women to come to us with their questions, come to their providers with their questions so they can make sure they're getting the right study in the right interval. We understand that there's lots of misinformation and confusing information. We really want people to get the truth. We have set up on the GAPS project website kind of a central place where women can go to get some very clear information on what they should be doing and what's the first step in getting a mammogram. So we really like to be able to make it easy for women to get a mammogram and for them to be encouraged to do so, and to encourage the people that they love to do so as well.
Well, it's been a pleasure to have you on the program. So thank you for your time. Really appreciate it. I know you're busy, so thank you.
Thank you.
Great message. Great message.
Thank you.
Life doesn't always give you time to change the outcome. Prediabetes does. 1 in 3 adults has prediabetes, but with early diagnosis, prediabetes can be reversed. And you can change the outcome. Take the 1-minute prediabetes risk test today. Go to doihaveprediabetes.org.
With record high inflation, this has been a tough year for many folks. One Holiday Hope program recipient said they have been through so much this year and could not afford basic needs. Holiday Hope allowed their family to get necessities such as socks, pajamas, and food. To talk about this year's Holiday Hope program and how you can help, joining us, we're very pleased to have back with us Jennifer with Community Thrift. So thank you for being with us.
Thanks for having me.
It has been a tough year. How is it going for the community? How is it going for the Holiday Hope program?
Yeah, we're seeing record numbers again, year after year. The numbers continue to go up. We started this program, this is our 52nd year of running this in the community. Yeah, and 2 years ago we expanded the program, and then COVID hit, and we're still seeing people trying to get out of that. But now the economy and inflation are just affecting people. They need to put gas in their car and they need to buy groceries. So if we can help them get through that by being able to provide a little relief with the gifts and gift cards for food, we're happy to do that.
So you've talked about some of the things they do. So a little bit more about the Holiday Hope program. I mean, how does it work? Who can participate in it? How does that go?
So 52 years ago, we started by serving the Stillwater School District boundaries. In 2020, we expanded to include Landfall, Oakdale, and all of Woodbury. Families, older adults, and adults with disabilities who are facing a financial hardship can register for the program. When they register for gifts or gift cards that they would like. And then we find sponsors. So we are out in the community getting businesses and individuals and groups to sponsor these people who register for the program.
And anyone can sponsor it and things like that?
Yes, we have sponsors from all over. Not just, certain areas, but really all over the Twin Cities are sponsoring people. I think what's unique about our program is that when you sponsor a family, you know it's a family right in your own community.
And how do you know what to give to the families? I mean, what are some of the requests that they have? I mean, we're talking about socks and pajamas. Seems so basic.
Yes, some are very basic. I think for parents, it's they register their children, and so they will list out items that their children want or need. We get a variety of items. Some register for gift cards. In the last couple years, that has been a change in our program with allowing gift cards. But parents came to us saying that they really felt empowered to be able to shop for gifts for their own children instead of having gifts bought for their children and already wrapped and not knowing what their children were getting. So that's something that we really wanted to keep.
I can see how that would be really important to families and their kids and things like that.
Yes, yes. Since 2019, the program has grown by 120%.
120?
Yeah.
Wow.
Which is a staggering number to think about. Last year we served just over 2,700 people in 1 week. So far we have over 1,300 people registered this year, and our registration is open through the end of November.
I was going to ask you how much longer people can register, how longer can people donate and things like that?
Yeah, sponsors, we are actively looking for more sponsors in the community. Sponsor registration goes through December 2nd. Families and older adults in the community can register through November 30th. We are at many different sites doing registration. We're out at Open Cupboard every Thursday for families to register.
And that's in Oakdale?
That's in Oakdale. And then at Community Thread in Stillwater, if people are having a hard time with the online form, they can make an appointment with us to come in. We have many different days and times available for appointment registration.
And you have some other open house or activities that people can sign up at that are happening in the next couple weeks here or something like that?
Yeah, we have different volunteer opportunities. This year our volunteer opportunities, thankfully, filled really fast. And so
that is great.
Yes.
We have such a great community and stuff that
we do.
People volunteering.
We do, and people when they volunteered once for this program, they really love to come back. And it's great for us because we are, there's 2.5 of us that run this program, and we couldn't be able to do it without the volunteers that we have.
What would be like your message to people that might be watching, like how they can get involved, how they can participate, things like that?
Yeah, well, if you know someone in need, certainly help them fill out an online form. We want to make sure that we can serve anybody that needs help right now. We also are still actively looking for sponsors. So if you or your business or your church or your organization is interested, you can go online. On our website is communitythreadmn.org, and you can find the Holiday Hope sponsor form. And you can indicate how many people you'd like to sponsor or how much money you'd like to spend. We then match you with a family. We began sending matches yesterday, so everybody's getting their matches right now. So they'll get their list, you get the list, you get their first names, and you do the shopping. Everything has to come back to Community Thread by December 7th.
It's so wonderful to be able to do that this time of the year, to really make a difference in people's lives and stuff, and especially with it being such a tough year financially for so many people. And
we run a Stuff the Bus program where we get school supplies to kids that need it, and we saw an increase of 54% this year in those numbers. And that program for us is kind of a leading indicator of what we can expect for Holiday Hope. So we're expecting, at least a 30% increase in the number of people we're going to serve. It may be more than that.
Is there a limit on how many that you do serve then, or is it just limited by the amount of donations that you receive?
It really is limited by the amount of donations. Right now we are planning for 30%. If we go higher than 30%, that's where we have to kind of reassess the money that we have coming in, what do we have available. We also have sites that are doing collections on our behalf, so they're collecting funds, they're collecting gift cards, and they're collecting gifts. And so we'll start getting all of those in early December, and so that will help us fill some of those gaps too.
Well, as always, it's a pleasure to have you back on the program and talking about Holiday Hope program. And final, if someone again, that address or that contact information, if
yes, our website is communitythreadmn.org.
Well, Jennifer, thank you so much. We really appreciate it, and good luck to everybody this season.
Thank you.
Thank you. Well, that is our program. Thank you for joining us here on Inside Healthcare. We'll see you next time on Inside Healthcare. Thanks.